In today's Hot Sauce, we are talking cold, and colder weather and the effects on you and your family's health. We're joined now by Dr. Brian Darcy from Catholic Health System. Good morning. Thanks for waking up with us. We appreciate it, especially because it is so cold outside. We hope you bundled up. But, you know, a lot of parents have been calling us and writing us on Facebook wanting to know about the effects of the very, very cold temperatures, these single digits, on their kids when they head out to the bus in the morning. What would you tell them and how to protect themselves?
Well, certainly one must be cautious, and probably the most important issue is to dress the children in layers, to make sure they have their hat on, to hopefully shelter them from the wind when they're out at the bus stop in the morning, and good mittens. Mittens are better than gloves with the fingers.
I think so, too.
That's good.
Now, that's simply because your hands are closer to, the fingers are closer together, right?
This is true, and you can bundle them up in your fist, and they stay warmer that way. So.
I agree. Now, poor Matt is actually out with the flu today, and Anthony's filling in. But Matt got his flu shot last week, but remind folks that doesn't always work that quickly, right?
No, that's a little late. It does have some effect even within a week or two. But generally, it's stated that it takes approximately 2 weeks for the immune response to kick in. So the earlier in the season one gets it. And the flu shot isn't perfect either, but it does do a very good job.
I feel like in the media we've been talking a lot about this flu season and how bad it's been. Are we starting to see maybe a break? Is it going down a little bit in the number of cases, or is it still pretty high? Are you seeing?
Our internal data suggests that it has peaked here locally.
Okay.
The last week of December, the first week of January into the second week of January was our plateau. Over the course of the past week, the number of patients that are presenting to us with influenza-like symptoms, the number of laboratory tests that are being submitted for flu, and the percentage of positives is drifting off. Earlier in the season, it was about 2%. It peaked at about 26% positives. And within the last week, it's down to about 17%. So we think it is tailing off.
Oh, well, that is good news.
This is good news.
For folks who have not gotten their flu shots, should they bother this late in the season?
Yes. Flu season, we generally characterize it as running from approximately October into March, April. It really runs into May. Influenza virus is present at all times of the year. We tend to get it more in winter because of the closed, cramped conditions of people staying inside. And so one should get it because we're not out of the woods yet.
Okay, so. Very good advice. Also, in the city of Buffalo, we are seeing some sunshine, even though north and south they're getting a lot of snow. But that sunshine and the vitamin D this time of year, you don't really think of that often, but it can be a big boost for your health.
Well, vitamin D is important, and certainly the metabolism of vitamin D in our body is related to exposure to sunshine. To my understanding, generally the latitude we're at on the globe, the latitude, even a little further north of here, it doesn't impact it too much, but it is certainly important that all individuals have some exposure to sunshine during the course of a week. It doesn't really take that much. To my recollection, it's really only approximately 20 to 30 minutes, several times per week. Will serve the course, but it's one of those interesting things about our bodies that the sunlight does help the metabolism to turn the vitamin D into its active forms. Very important.
Well, I think that sounds great. Thank you for helping us stay healthy and warm and safe during these winter months. We appreciate it. Dr. Brian Darcy. Now we're going to send it over